A tourniquet is a compressive device that occludes blood flow to the limbs to prevent severe blood loss from limb trauma during emergency, create a bloodless surgical field, and decrease perioperative blood loss. It is also used for intravenous regional anesthesia to prevent the central spread of local anesthetics. Surgical tourniquets enable surgeons to work in a bloodless operative field by preventing blood flow to a limb, allowing surgical procedures to be performed with improved accuracy, safety, and speed. They come in two basic designs: non-inflatable made of rubber or elastic, and inflatable pneumatic tourniquets that use compressed gas to inflate a bladder or cuff to occlude blood flow. Limb occlusion pressure, or EOP, is defined as the minimum pressure required to stop the flow of arterial blood into the limb distal to the cuff. It is determined by gradually increasing tourniquet pressure until distal blood flow is interrupted. Guidelines recommend adjusting cuff inflation pressure by adding a safety margin based on the patient's systolic blood pressure. Various methods to lower effective cuff pressure include the double tourniquet technique to change the point of compression, controlled hypotension to reduce systolic blood pressure, and use of Doppler technique and pulse oximetry to confirm absence of arterial pulse and determine minimum inflation pressure. The safe tourniquet inflation time varies with patient factors, but generally limits range from 1 to 3 hours. It is recommended to assess the operative situation at 2 hours, and if duration exceeds 2.5 hours, to apply a 10-minute deflation interval and subsequent intervals every hour. Common complications of tourniquet use include nerve injury, paresthesia, paralysis, muscle injury due to ischemia, compartment syndrome, vascular injury, skin injury, and hematoma formation. Traction is a mechanism for straightening fractured bone or relieving pressure on a site. Types include skin traction and skeletal traction. Indications are to regain normal length of the bone, reduce muscle spasm, reduce pressure on nerves, and prevent skeletal deformity. Skin traction is indicated for temporary management of paratracheic and femoral neck fractures, femoral shaft fractures in children, undisplaced acetabular fractures after reduction of dislocated hip, treatment of minor flexion deformities, and management of lower backaches. Contraindications include ulceration at the site, disturbed circulation, varicose veins, and dermatitis. Skeletal traction is indicated in cases contraindicated for skin traction, presence of external fixation, or when a traction weight greater than 6.5 kilograms is required. Plaster of Paris casts are commonly used for immobilizing injured limbs. Indications include temporary immobilization of joints and ligaments to reduce pain and inflammation, splinting undisplaced fractures, augmentation for internal fixation of some fractures, and splinting for tendon and ligament repair. Fiberglass casts have advantages over plaster, including lighter weight, greater durability, porosity allowing airflow, water resistance, and suitability for X-ray imaging during healing. They are also available in a variety of colors.